2,561 deaths. As the country gears towards Cancer Awareness Week, health stakeholders are meeting in Nakuru to deliberate on the matter. Now let's join our reporter Ken Gashohe for the details.
Indeed, it has been a fruitful engagement here with various stakeholders in the health sector concerning various types of cancers. And here with me is Dr. Dulcie Wanda, who can tell us an overview of the state of cancer in the country and maybe how is the situation here in Nakuru County.
Thank you very much. We're pleased to have this meeting today. I think cancer has become number 3 in terms of deaths in Kenya, following cardiovascular diseases and infectious diseases. That's just to tell us that we have a great number of people who have been affected by cancer. Nationally, the statistics have been that breast cancer had always been leading. But as the recent statistics have come back, it's showing that cancer of the cervix is taking a lead, both in incidence and also in mortality, meaning we're losing very many women to cancer of the cervix. In Nakuru, the statistics are not any different. We have cancer of the breast at 15% and also cancer of the cervix at 15%. We've been able to disseminate our screening activities and also the treatment Skin and Treat at the sub-county level. So we are getting a lot of data from the sub-county. And when we compare our statistics nationally, then Nairobi is ranked first in terms of the number of cancer cases and Nakuru is second. So that's just to say we have a large number of patients from Nakuru that have cancer and undergoing treatment. Cancer of the cervix is unique because it is one of the cancers that we can prevent with vaccination. Research has shown that cancer of the cervix, the human papilloma virus, is greatly indicated, especially the strains 16 and 18. And this is a virus that can be vaccinated against. And we can do that before someone has a sexual debut. Research in Kenya was done and it was shown that most of the people on average have sex with around the age of 14, 15, hence the age bracket that we are focusing on. So we are focusing on vaccinating between the age of 9 to 14 before someone has their first sexual debut so that we can protect them from the human papilloma virus, which causes cervical cancer. I think as an oncologist, it always is heartbreaking to treat a patient with cancer, to see them going through the psychological and even the treatment that sometimes can be quite rigorous. However, this is one cancer I am pleased to talk about because once we discuss it, when people understand it is one cancer we can prevent, we can make sure our girls do not have to go through cancer of the cervix.
Thank you very much. Talking of screening, maybe you can tell us your name and where you work at, and also what are your efforts towards addressing this challenge of cancer?
Thank you. My name is Dr. Michelle Ngu. I come from the National Cancer Institute. I'm a director at the Cancer Prevention and Control Directorate. And this month, we've partnered with different government and non-governmental agencies in this fight against cervical cancer. So we are in Nakuru to officially launch HPV screening countrywide. We'll be doing that official launch on the 22nd at the Nakuru County Level 5 hospital. We have partnered with different stakeholders who will be offering a screen and treat approach for the cervical cancer. Roche, Savannah Global Health Institute, Mobilab, among KEMRI, KEMSA, to also help with the vaccination of the age group 9 to 14. And yes, we are calling out to the people of Nakuru. Tell a sister, tell your wife, tell a neighbor, please, from the ages of 25 to 49, free cervical cancer screening, all sub-county hospitals. Thank you.
Thank you very much. Talking about information and sharing information to people in time to ensure they get treatment on time and make it even easier to recover from this disease. Maybe what is your department doing about this?
Thank you so much. My name is Lynette Koskei. I work at the National Cancer Institute of Kenya under the Directorate of Cancer Prevention and Control, the Department of Information, Education and Communication. Our main function within the department is to conduct public education and cancer awareness alongside providing free cancer screening across all the 47 counties within the country. Within the institute, we have a robust program that is specifically tailored to each county within the country. So for the World Cervical Cancer Commemoration Month, we shall be holding the commemoration in Nakuru County simply because Nakuru County ranks second in terms of cervical cancer incidences. And for the World Cancer Day, we shall be holding the commemorations in Turkana County. Why Turkana County? Turkana County is a marginalized county, and we are getting very low data, so there is need to raise awareness. So our main function is just to go across the country, raise awareness, encourage screening and early detection. Thank you so much.
Thank you very much indeed. Those are various stakeholders in the fight against cancer and various other different types of cancers that are affecting Kenyans and becoming one of the leading causes of deaths and suffering among many families here in the country. But next week will be the climax of this campaign to ensure that people are aware of what cancer is and how it can be prevented and treated. Back to you in studio.
All right, thank you, Ken, for that update. And that story from Nakuru County takes news desk to a very fast commercial break. But don't go too far, still much ahead on the other side.